study presented at ESMO this year was a subgroup analysis from the phase 3 ASCENT study. So it was a predefined analysis to evaluate the impact of the treatment on the health-related quality of life of the patients treated with sacituzumab as compared to the effects of the control arm on their health-related quality of life outcomes. So the primary aim of the trial was to evaluate potential differences in quality of life according to the treatment arms in the trial. So the primary aim was actually to show that there was an improvement in global quality of life. And when we looked to some primary health-related quality of life domains, we effectively saw that there was a significant and a clinically meaningful improvement in health-related quality of life scores for those patients treated with sacituzumab as compared to those treated in the control arm with a single-agent chemotherapy of treatment physician choice. So we saw significant improvements for global health status, but also for physical functioning and emotional functioning. And these were all significantly better when we compared these results with those randomized in the treatment arm. So there was also less symptomatic impact of fatigue, of pain, and of dyspnea in the patients treated with sacituzumab compared to those in the experimental arm. The only symptom burden which was higher was diarrhea. And diarrhea is a known side effect of sacituzumab govitecan. This was significantly, but also meaningfully worse for patients treated with Trodelvy. However, this did not appear to translate in an adverse effect on the patient's global functioning, on the patient's global health score. So this is actually a reassuring finding. I think that the implications of this research are that it increases the value of Trodelvy in the specific treatment setting. So when we have a new drug that improves outcomes, usually in the beginning, we are lacking data, patient-reported outcomes on quality of life. And of course, in the incurable setting of metastatic triple-negative breast cancer, patients are frequently confronted with a high symptomatic burden of disease, and therefore the effect and the evolution of the quality of life in different treatment arms is an important factor to consider when we prioritize treatments. And given these positive results, this does not only show that we improve the outcome, but that we also improve the quality of life while prolonging the disease course of those patients. And that is an important takeaway, which is also validated into some clinical scales used to assess the value of new anti-cancer treatments. And taken into account a specific example for Trodelvy, we anticipate that these positive results of health-related quality of life will actually result in even an upgrade of the value of Trodelvy, for example, in the ESMO magnitude of clinical benefit scale.